This video demonstrates proper squat technique using a realistic three-dimensional medical body for clear educational understanding. Squats are a fundamental lower body exercise that builds strength, balance, mobility, and coordination effectively. Begin with feet shoulder width apart and toes slightly angled outward for stable squat positioning. Push hips backward while bending knees to initiate the squat movement safely. Lower until thighs approach parallel while keeping heels flat and chest lifted. Quadriceps muscles control knee movement during both lowering and standing phases. Glute muscles activate strongly to extend hips and return to standing position. Hamstrings assist balance and stability throughout the squat movement. Core muscles brace the torso to protect the spine during squats. Maintaining a neutral spine reduces lower back stress and improves force transfer. Inhale slowly during the descent to maintain stability and internal pressure. Exhale smoothly while standing up to support strength and breathing rhythm. Proper breathing improves endurance and efficiency during repeated squats. Knees should track over toes to maintain correct joint alignment. Knees collapsing inward increase joint stress and reduce squat effectiveness. Excessive forward leaning shifts load unnecessarily onto the lower back. An upright torso improves balance and distributes force evenly across muscles. Using full depth activates more muscle and improves overall squat results. Partial squats limit muscle engagement and slow strength development. Proper squats strengthen hips, thighs, and core together efficiently. Regular squatting improves posture and functional lower body coordination. Correct squat technique supports long-term knee and hip joint health. Squats train multiple muscle groups to work together in coordination. Good squat form significantly reduces injury risk during training. Beginners should focus on slow, controlled squats to learn proper mechanics. Fewer quality repetitions outperform many rushed repetitions with poor form. A steady squat tempo improves control, balance, and muscle engagement. Proper squats enhance lower body stability and balance. Consistent practice leads to noticeable strength and mobility improvements. Athletes and rehabilitation programs rely on squats for functional strength. Squats require no equipment and use natural human movement patterns. Squats can be performed almost anywhere at any time. Correct squats build joint-friendly lower body strength. Efficient squat mechanics conserve energy and improve performance. Focus on alignment, breathing, and control during every repetition. Pay attention to discomfort signals from knees, hips, or lower back. Stop squatting if sharp pain appears in any joint. Safe squat practice supports long-term injury prevention. Master squat fundamentals before increasing intensity or training volume. Start practicing squats today to build a stronger, healthier lower body.